presentations periodically to look at the problems that people have identified in various areas of healthcare, and basically quality of life is really what it comes down to. And that's what people's interest is in healthcare, is if they're not feeling well, they want to feel well. Or they want to make sure that there's not something going on that could make them sick down the road. That's why we do a lot of preventative care or various screenings. So last year we spent a lot of time talking about some of the new interventions in cancer research and that sort of thing. This year I'm glad to see that we're talking more about caregivers and the impact on families. What we've done at Fort Defiance is to take a step back and to look at how we provide care to people who have various serious illnesses or who are frail because they're very old, and to look at how we can provide better care for those individuals in the context of a system. I mean, you can have these kinds of meetings and identify problems, but the only way that we're going to move forward and actually improve people's lives is if there's a system. There has to be a framework in which to address issues. Otherwise, you just have people trying to do things, but they're spinning their wheels, and that's what often happens with caregivers. They're trying to provide care to somebody who has a serious medical problem, but it's not in the context of a system. There's not a support system around them, and they become stressed out. And in fact, as was stated earlier, caregivers do actually die at a higher rate. Studies have looked at caregivers, and it turns out that the average age of caregivers in the United States is about 69 years old. Most caregivers have at least 2 major medical problems, and they die at a rate 60% higher than age-matched non-caregivers. And what this tells us is that people are under a lot of stress at home, and they don't have the support that they need. So we've tried to address that. Next. When we take a look at the healthcare system, first and foremost, the healthcare needs of this fragile population, and the fragile population I'm talking about are people who have a diagnosis of some kind, or are very elderly, or at high risk for developing something bad. They have a high, they have a family history of malignancy, that sort of thing. But we have to make sure that the needs are addressed in a comprehensive fashion and that they are patient-centered. Now, this is something that people say, well, yeah, that makes sense. But in fact, the healthcare system in the United States isn't patient-centered. It's centered on a lot of other things. And it's driven by a lot of money. And it also isn't comprehensive. We sort of piecemeal healthcare. Next. Providers at all levels, and this is professional and non-professional providers and family members, need to work to become part of interdisciplinary teams. Interdisciplinary means that the teams work together. I'm going to talk about this a little bit because it really is what separates our program from a lot of other programs. You break down the walls between the team members. We have perhaps multidisciplinary care in the United States where you need to see a specialist over here, and then you're going to see somebody over here, well, you need an x-ray over here, and you need something over here. And that information may or may not get shared. In fact, most of the time it doesn't get shared. And so there's a lot of inefficiency in the system, there's a lot of duplication of services, or there's services that are missed because the different specialists aren't talking together. So the delivery system has to support this interdisciplinary approach. And that is where I believe that American medicine is heading. It has to head there, but it's a long way yet. Next. Those 2 quotes were from a very exhaustive study that was published last year by the National Academy of Science Institutes of Medicine, and it was called Retooling for an Aging America, Building the Healthcare Workforce. Now, all of the issues of aging are also the same issues that are faced by people who have any major chronic medical illness. I mean, it impacts their ability to work, it impacts their ability to care for themselves, it impacts their family, it impacts people at all levels. And so we have to start taking a more global view of the impact of disease or potential disease on the individual and their family. Next. Just to look briefly at, we looked at a lot of statistics today about cancer rates in Native American, non-white population compared to white population in the United States. And if you look at the life expectancy that's published now by the CDC, males live about 76 years, females live about 81 years in the United States if you're white. If you're black, it's some years less than that, about 5 years less. The published data from Navajo area, and again, this is going back to 1999 because in many cases our data just is not current. Males, it's about a decade less, and females, it's about a half a decade less. Next. Well, we looked at the actual numbers at Fort Defiance, and I don't think our numbers are any different than any place else. I think we've just looked very carefully at our numbers, and we've looked at people from our service unit that not only die on the reservation, but have passed away in Albuquerque, Phoenix, wherever. And we've actually looked at the age of death of our population. And for males, it's about 56 years, and for females, it's about 64 years. And if you look back at the records in the United States for longevity, for males, that was the longevity in about 1929, and for females, that was the longevity in 1940. So we're approaching a decade, or almost a century behind where the rest of the United States is. And this is driven by a lot of things, and some of the issues that impact this were touched on earlier. For example, with cancer, it's diagnosed later. People die sooner. I mean, for a lot of reasons. We're not here to fix that all today, but the fact is, violence plays a role. Alcohol use plays a role. Lack of preventative services. It's not a lack of availability so much necessarily. We do have a lot of Indian Health Service hospitals and clinics, but transportation is difficult, especially for people who live away from paved roads. I mean, it's just simple things like that. We have about 25% of our elders live in homes with no running water or electricity. And if you look at what has been the biggest impact on health care throughout the world, it's actually not drugs, it's sanitation. That's what's made the biggest difference. People having clean drinking water, being able to wash their hands, that sort of thing. Next. So the approach that we've taken in the program at Fort Defiance, we call it our home-based care program. And that the title of the program is important because historically healthcare has been sort of hospital-based, or it's been clinic-based. But that's not where people live. People live at home, and people who have serious or chronic medical illnesses live with those illnesses 24 hours a day. They don't just live when they come in to see us in the hospital. They live with that illness. Their family lives with that illness. The caregivers live with that illness. And so we wanted to focus our attention to the home. So we call it our home-based care system. And it is an interdisciplinary system. And if you look at interdisciplinary systems, they're collaborative, they're patient-centered. You have physicians, nurses, social workers, and then other services, physical therapy, occupational therapy, but then also others are part of the system. The drivers, how do you get from here to there? How do you take food from here to there? In-home care providers. And there has to be regular communication. Now, our entire team, and I'll go into a little bit greater detail about how our team works, but we meet formally every week. The entire team meets for an hour on Wednesday, and we discuss issues. It could be, difficult situations at home, or a nurse may have picked up something and they need a social worker involved. But we also communicate on a daily basis. By design, we put all of the disciplines of our program in the same location. So the nurses are right next to the social workers, are right next to the diabetes program, right next to the psychologist,